I'm Daniel Yang. I'm the Patient Care Fellow at the Gordon Betty Moore Foundation. And on behalf of the foundation, we'd like to warmly welcome all of you today. I think we've already started off on an incredible journey this morning with fantastic speakers, really providing insight around that intersection between healthcare, the essence of healthcare and the practice of medicine, and these new technologies of artificial intelligence and machine learning. A lot of these interests intersect closely with our work at the foundation. The Gordon Betty Moore Foundation was started 17 years ago by Gordon and Betty Moore. Gordon Moore was the co-founder of Intel. For the last 12 years or so, we've been exploring the space of patient care, specifically interested in how we can improve the outcomes and experiences of patients. Our work in patient safety was really inspired by an experience that Betty Irene Moore had in the hospital, in which she was a victim of a preventable medical error that nearly cost her life. So over the last 2 years, we've been specifically exploring the role of the Moore Foundation playing in diagnosis and diagnostic errors, which the National Academy of Medicine estimates that probably every single one of us will experience a diagnostic error in our lifetime. So we're also excited about the opportunity of new technologies like artificial intelligence and machine learning in improving diagnosis by supporting busy clinicians, similar to the remarks that Eric Topol made, as well as giving insight to healthcare systems on the frequency of diagnostic errors and the impact that they cause. In reality, we want to support a new movement of what we describe as diagnostic excellence. So it's not just about reducing errors, but it's about providing optimal diagnostic care for all patients. And so given our interest in these topics, we were enthusiastic to support this symposium when we were introduced with the idea by Abraham and his team. I'm also very honored to introduce the speakers of the Diagnostic Excellence subtrack. We'll start with Dr. Lawrence Tierney, who's an expert physician that I've actually had the privilege of training under. I know that there are probably others in this room as well. LT, as he's affectionately known, has trained a generation or generations of expert physicians and diagnosticians. I learned yesterday that he's been attending and pretty much contributing to every single VA morning report in San Francisco for 44 years. So an embodiment of incredible amount of experience and knowledge and empathy and captures really the true qualities of a master diagnostician that I think all clinicians aspire to. He'll be followed by Dr. Mark Graber, who is described by many in the field as the godfather of the diagnostic safety movement. He's the founder and president of the Society to Improve Diagnosis in Medicine, which is an organization that coordinates much of the research, advocacy, and education in the field. He'll provide some general context and argue why diagnosis is important and why it's so important in getting it right. He'll also describe the unfortunate reality of how our healthcare system and clinicians routinely fall short of the quality of care that patients expect from us. And lastly, we'll hear from Dr. Art Papier, co-founder of Visual DX, which is a leading clinical diagnostic decision support tool. He'll provide us a brief overview of how we can leverage technological tools to improve diagnosis, but also the pitfalls that might come with that. His remarks will be drawn from decades of his own experience, sitting at the intersection of entrepreneurship, academia, and healthcare delivery. So thank you again for joining us. I really hope from this discussion that some of you in the audience might be inspired to consider your own role in advancing a future of diagnostic excellence. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.